I want to talk to you today about something a great many older adults notice and usually shrug off as just part of getting older, or just being someone who feels the cold. Persistently cold hands and feet. Maybe your fingers and toes are cold even when the room is warm, even when the rest of you feels fine. Maybe you're always reaching for socks and gloves, always the first to feel a chill. Maybe your hands and feet take forever to warm up, or they turn pale or bluish in the cold. And while feeling the cold more as you age is, to some degree, ordinary, persistently cold hands and feet can sometimes be your body's way of telling you something about your circulation, your thyroid, your blood, your nerves, or other things worth understanding. So today I want to explain why hands and feet get cold, why it becomes more common as we age, what the various causes are, which are harmless and which are worth a doctor's attention, and what you can do about it. And I'll keep this calm and honest, because most cold hands and feet are not a sign of anything dangerous. But the pattern is worth understanding, because occasionally it points to something treatable. Let me start with why your hands and feet get cold in the first place, because understanding the mechanism makes all the causes make sense. Your hands and feet are at the far ends of your body, the extremities, farthest from your warm core and from your heart. To keep your vital core and organs warm, your body prioritizes blood flow to the center, and when it needs to conserve heat, it narrows the blood vessels to the hands and feet, reducing blood flow there, which is why your extremities get cold first and most. So the warmth of your hands and feet depends heavily on good blood flow reaching them, carrying warmth from your core. Anything that reduces that blood flow, or reduces your body's heat production, or affects how your blood vessels respond, will tend to leave your hands and feet cold. That's the core idea. Cold hands and feet are usually about blood flow and heat reaching the extremities. And several things change with age, and several conditions can interfere with this, which is why cold extremities become more common and can sometimes signal something. Let me start with the ordinary, harmless explanations, because they cover a lot of cases. First, some increased sensitivity to cold is simply part of aging. Our circulation becomes a bit less efficient. We have less insulating fat under the skin. Our metabolism and heat production decline somewhat, and our body's temperature regulation becomes less sharp. So older adults often feel the cold more, including in the hands and feet. Second, simply being in a cold environment, or being cold overall, naturally causes the body to reduce blood flow to the extremities to conserve core heat. So, cold hands and feet when you're chilly is just normal physiology. Third, anxiety and stress can cause the blood vessels in the extremities to narrow, leaving hands cold. Fourth, smoking narrows the blood vessels and worsens circulation to the extremities. And fifth, there's a very common, usually benign condition called Raynaud's, where the small blood vessels in the fingers and toes overreact to cold or stress, clamping down sharply so that the fingers or toes turn white, then sometimes blue, then red as blood flow returns, often with numbness or tingling, then warmth. Raynaud's is common, often mild, and usually not dangerous on its own, though it can occasionally be associated with other conditions, so significant Raynaud's is worth mentioning to a doctor. So a great deal of cold hands and feet is simply ordinary aging, cold environments, stress, smoking, or benign Raynaud's, none of which is cause for alarm. Now let me turn to the causes that are worth a doctor's attention, because persistently cold hands and feet can sometimes be a sign of an underlying condition, And knowing these is the useful part. The first is poor circulation from narrowed arteries, peripheral artery disease, which I've discussed elsewhere. When the arteries supplying the legs and feet, or arms and hands, become narrowed by the fatty buildup of atherosclerosis, blood flow to the extremities is reduced, leaving them cold. And this is more likely in older adults with risk factors like smoking, diabetes, high blood pressure, and high cholesterol. Importantly, peripheral artery disease is a marker of artery disease elsewhere, including the heart. So it matters. And it often comes with other signs, like leg pain when walking, that eases with rest, color and skin changes, slow healing wounds, especially if one foot or limb is colder than the other. So persistently cold feet, particularly one colder than the other, or with those other signs, is worth checking, because it can point to circulation that needs attention and reflects your wider cardiovascular health. The second important cause is an underactive thyroid, hypothyroidism, which is common in older adults and slows the metabolism, reducing heat production, so that cold intolerance, including cold hands and feet, is a classic sign, often along with fatigue, weight gain, dry skin, constipation, and low mood. Hypothyroidism is very treatable once diagnosed with a simple blood test. And feeling cold all over, including the extremities, is one of its hallmark signs, so it's well worth considering. The third is anemia, also discussed elsewhere. When the blood can't carry enough oxygen, the body prioritizes the core, leaving the extremities cold. And anemia is common in older adults and detectable with a simple blood test, often with fatigue, pallor, and breathlessness alongside. The fourth is diabetes, which can cause cold feet both through poor circulation and through nerve damage, neuropathy, that affects how the feet sense and regulate temperature, and which also numbs the feet, raising the risk of unnoticed injuries. The fifth is nerve problems more generally, peripheral neuropathy from diabetes, from vitamin B12 deficiency, or other causes, which can make the feet feel cold, numb, or tingling. And certain medications, like some used for blood pressure and heart conditions, can cause cold extremities as a side effect. So cold hands and feet can signal poor circulation, an underactive thyroid, anemia, diabetes, or nerve problems, several of which are common and treatable, which is exactly why the persistent pattern is worth a doctor's attention. Let me be clear and balanced, though, because I don't want to alarm you into thinking cold hands and feet means something is wrong inside. The majority of cold hands and feet in older adults are due to the ordinary, benign causes: aging, cold environments, stress, benign Raynauds, and so on, and are not a sign of anything dangerous. So please don't panic if your feet are often cold. The point of knowing the medical causes is so you can recognize the patterns that warrant a check, rather than worrying about every chilly toe. So let me give you those patterns. It's worth seeing your doctor about cold hands or feet if the coldness is persistent and not explained by a cold environment. If one hand or foot or one limb is noticeably colder than the other, which can suggest a circulation problem on that side. If it comes with other signs, like leg pain on walking that eases with rest, color changes, slow healing sores, numbness or tingling, or skin changes, pointing to circulation or nerve issues. If it comes with general signs of feeling cold all over, plus fatigue, weight gain, dry skin, and constipation, suggesting thyroid trouble. If it comes with fatigue, pallor, and breathlessness, suggesting anemia. or if your Raynaud's type color changes are severe, or you develop sores on the fingers or toes. Any of those patterns is worth a doctor's evaluation, which often involves simple blood tests for thyroid and anemia and an assessment of your circulation. So the framework is ordinary cold hands and feet in the cold, or with mild benign causes, need no alarm. But persistent, one-sided, or accompanied by other symptoms, cold extremities, are worth getting checked. So let me give you the practical things you can do, both to keep your hands and feet warm and comfortable, and to support good circulation. First, keep warm. Dress in layers, wear warm socks and gloves. Keep your home adequately heated, and warm your hands and feet when they're cold, but gently, not with extreme heat, especially if you have reduced sensation, because you could burn skin you can't feel well. Wear warm footwear and avoid letting your feet get cold and damp. Second, keep moving. Regular physical activity, even walking, boosts your circulation and helps deliver warmth to your extremities. And simply moving and wiggling your fingers and toes when they're cold helps. Third, don't smoke, because smoking significantly worsens circulation to the extremities, so stopping genuinely helps. Fourth, manage stress, since stress narrows the vessels to the hands. Fifth, be cautious with caffeine, which can narrow blood vessels in some people. Sixth, stay generally healthy in ways that protect your circulation. Manage blood pressure, cholesterol, and blood sugar. Eat well, and stay active, all of which support the blood flow your extremities depend on. And seventh, if you have diabetes or reduced sensation, take special care of your feet, checking them daily and protecting them, because cold plus numbness raises the risk of unnoticed injury. These measures keep you more comfortable and support the circulation that warms your hands and feet, while the underlying causes, if any, are addressed by your doctor. Let me say a special word about safety, because cold extremities connect to a couple of genuine risks. First, for anyone with reduced sensation in the feet, from diabetes or neuropathy, cold feet can be dangerous because you may not feel cold injury, burns from trying to warm them too aggressively, or developing sores. So gentle warming and daily foot checks matter. Second, older adults are generally more vulnerable to cold and to low body temperature, hypothermia, than younger people because of that less efficient temperature regulation. So in cold weather, keeping the whole body warm, not just the hands and feet, genuinely matters for safety. Cold hands and feet can be an early sign that you're getting too cold overall and need to warm up. So treat persistent cold, especially in cold weather, as a cue to warm your whole self, and be aware that older adults can become dangerously cold even in conditions that wouldn't trouble a younger person. That's a safety point worth holding alongside the comfort measures. Let me paint you a picture of how this commonly plays out, because it shows the calm, sensible response. Picture a woman in her 70s whose hands and feet are always cold, even in a warm room, and who's noticed she generally feels the cold more than she used to, along with feeling tired, gaining a little weight, having dry skin, and being constipated. She's assumed the cold hands and feet are just her, just age, just being someone who feels the cold. But she mentions it to her doctor, partly prompted by the tiredness. And the doctor recognizes that cold intolerance plus fatigue, weight gain, dry skin, and constipation point toward an underactive thyroid, does a simple blood test, and confirms it. With thyroid treatment, her metabolism and heat production improve, and her cold hands and feet, along with the other symptoms, get much better. What she'd dismissed as just being someone who feels the cold was a treatable thyroid condition all along. Now, in a different version, the cause might be anemia found on a blood test, or poor circulation prompting attention to her cardiovascular health, or simply benign aging and Raynaud's needing only warm socks and reassurance. In every version, the response was right. Most cold hands and feet are benign, but the persistent pattern, especially with other symptoms or one-sidedness, is worth a check because it sometimes reveals something treatable. That's the spirit I want for you. And let me speak directly to those of you caring for or close to an older person, because cold hands and feet are easy to notice and sometimes worth acting on. You might notice a loved one always cold, always bundled up, with cold hands when you touch them, or complaining of cold feet. Usually this is benign, ordinary feeling the cold, and the right response is simply comfort and warmth. Layers, warm socks and gloves, adequate heating, and encouraging activity and not smoking. But you can be alert to the patterns worth checking. Persistent coldness with other symptoms like fatigue, weight gain, dry skin, and constipation, suggesting thyroid trouble. With fatigue, pallor, and breathlessness, suggesting anemia. With leg pain on walking, color changes, or slow-healing sores, suggesting circulation problems. Or one limb colder than the other. In those cases, gently encourage a doctor's visit, since simple blood tests and a circulation check can find treatable causes. And importantly, be aware of the broader cold safety issue. Older adults are more vulnerable to becoming dangerously cold, so in cold weather, make sure they're keeping warm overall and their home is adequately heated. And watch for signs of them getting too cold. For someone with diabetes or numb feet, help with foot care and gentle, safe warming. That attentive care keeps a loved one comfortable and catches the occasional treatable cause. Let me draw this all together. Cold hands and feet are common in older adults, and they're usually about blood flow and warmth reaching the extremities, which the body sacrifices first to protect the warm core. Most cold hands and feet are due to ordinary, benign causes. The increased cold sensitivity of aging, cold environments, stress, smoking, and the common, usually mild condition, Raynaud's. But persistently cold hands and feet can sometimes signal an underlying condition worth treating. Poor circulation from narrowed arteries, peripheral artery disease, which also reflects wider cardiovascular health. An underactive thyroid, common and treatable, with cold intolerance as a hallmark sign. Anemia, diabetes through both circulation and nerve effects, and nerve problems like neuropathy. So while most cold extremities need no alarm, the patterns worth a doctor's check are coldness that's persistent and unexplained, one-sided, or accompanied by other symptoms like leg pain on walking, color or skin changes, slow-healing sores, numbness, or the fatigue, weight gain, and dry skin of thyroid trouble, or the fatigue and pallor of anemia. Meanwhile, keeping warm, staying active, not smoking, managing your cardiovascular health, and protecting numb feet all help, and older adults should be mindful of the broader risk of becoming dangerously cold. So here's what I'll leave you with. First, understand that cold hands and feet are usually about reduced blood flow and warmth to the extremities, and that most cases in older adults are benign, ordinary, feeling the cold environments, stress, smoking, or mild Raynaud's, not a sign of anything dangerous. Second, take simple steps to stay warm and support circulation. Dress in layers. Wear warm socks and gloves. Keep your home heated. Warm, cold extremities gently. Stay physically active. Don't smoke, and manage stress. Third, see your doctor about cold hands or feet that are persistent and unexplained, that affect one limb more than the other, or that come with other signs. Leg pain on walking, color changes, slow healing sores, numbness, or the fatigue, weight gain, and dry skin of possible thyroid trouble, or the fatigue, pallor, and breathlessness of possible anemia, because simple tests can find treatable causes like an underactive thyroid, anemia, or circulation problems. Fourth, take special care if you have diabetes or numb feet, warming gently and checking your feet daily. And be aware that older adults are more vulnerable to becoming dangerously cold overall. So keep your whole self warm in cold weather. Cold hands and feet are usually just a comfort issue, easily managed. But the persistent pattern is sometimes a useful signal worth heeding. So take care of yourself, keep warm, support your circulation, and get the persistent or accompanied by symptoms kind checked. And because only a doctor can examine you and run the tests to find any underlying cause, please treat persistent, one-sided, or symptom-accompanied cold hands and feet as your reason to see your own physician, who can find the cause and help rather than as a substitute for that visit.